can be painful, but not all aches and pains need to be treated with medicine.
Our next guest says that when it comes to acute pain, it's better to identify the triggers and opt for lifestyle modifications and non-prescription choices first. That's why he wrote the book Bond, the 4 cornerstones of a lasting and caring relationship with your doctor. Dr. Ken Redcross is here to share some simple ways to treat common causes of pain.
Absolutely.
Welcome back. It's so good to see you again.
It's always good to be here with you guys. Thanks for having me back.
He comes in from New York for us, so
He does it just for us.
Absolutely,
Yes.
because you're that important.
Yes,
and I
our
mean
viewers,
it.
yes.
I mean it.
All right, okay. Do you always need to see a doctor for pain complaints? I never go to a doctor, so you got to set the story
Say
straight
it isn't
here.
so. Look, if the pain persists, I would say for more than a couple of days, give us a call. Make sure you come in, because sometimes it can mean that you're missing something that can later cause a big problem later.
Yeah, okay.
I've been dealing for weeks and weeks and weeks
Oh,
with
yeah.
what people call texting thumb.
Oh, yes.
It's terrible, but I know you're going to talk about texting neck.
I am.
So hopefully whatever you have for text neck can help my thumb.
You know, that's
too.
perfect that we bring that in. I have that cell phone over there, way on the other side.
Oh,
the reason
That's
why
right. Is this your flip phone here?
it is the flip phone, the BlackBerry. I'm showing my age there, guys. But the point
heck?
is, I know.
Okay.
But the point is that you can get something called text neck overuse syndrome, which is pretty much a long word or phrase saying that you have a sore neck because you're bending all day.
Yes.
It's something that's a little more common. And also that text thumb. Once again, it's because of the overuse. Because don't forget, we're talking about activities that we love doing, but we're overdoing them and
Yes.
we're overlooking the pain.
Okay.
So what is the fix
yeah.
for it besides, you know, cutting back?
Yeah, all right. So what you can do, at least with your cell phone, actually for both of those issues, you can make sure that, number one, I set an alarm. The alarm tells me at about an hour and a half or 2 hours. For the text neck, I make sure that I relax, I move my neck around, and I stop looking down. And even for the text thumb, it's time to maybe take a little bit of a break from texting for a quick second. So it's a little bit more relaxation than anything.
Should I take her phone away from her?
I don't know how that'll
Hand
go.
over the phone.
I know she'll show you her judo moves. I don't know.
I see her phone. I'm going to take it from her.
Right under here.
Okay, the next one. Paula does a lot of gardening.
Good.
My husband does
do.
a lot of gardening, and the back can really feel it.
Yeah, you know, it's so common to get what's called gardener's back. About 70% of gardeners get it. You're lifting all these heavy pots in these awkward positions, but I brought my own personal garden in all the way from
What
New
is
York.
this about?
Well, the reason why is because I wanted everyone to let's think a little bit closer to the earth when we're thinking about healing. One of the better things I talk about, I have these daisies here because one of the best things out there that helps for pain, swelling, and bruising is Arnica montana.
Yes.
Arnica montana is actually sold as Arnicare, and it's been around for over 200 years. So when you're thinking of staying closer to the earth, let's think of something like Arnica montana or Arnicare. That we can't grow that because that only grows in the French Alps. So what can we grow here in our garden? So one of the
Okay.
things I have here, I have edamame. Now edamame is interesting because there was a study that showed it could possibly help with osteoarthritis.
Really?
So
like
it's something
like
that you can
ingesting it or
Yes.
rubbing it? Okay.
No, no, no rubbing. I know you wanted to figure that out.
What is that all over your face?
I was just going to be like,
Some edamame paste. No, please don't rub it. Don't say Dr. Redcross said that. We're going to make sure that we ingest it and get a little bit of the benefit. I also have turmeric over here for you guys. We're all familiar with
It's
turmeric.
anti-inflammatory,
There
right?
you go.
Okay.
All about inflammation. I also have some hot peppers over there because peppers are loaded with capsaicin. Capsaicin is the reason why when you eat hot food, you feel those little numbness on your tongue. It can also help you for your pain as well. And last but not least, I had a little issue here, but I have to make sure that I brought ginger. The ginger fruits that are there
Ginger
because they're
helps?
also, it does, because ginger is also anti-inflammatory as well. Also very relaxing should you get any spasms in the belly and that sort
I
of
do
thing.
take that if I have a stomach ache. I always
Right.
take some ginger.
And it
That's
works
helpful.
almost immediately.
I'm so glad you cleared all this up. I would be in the produce section grabbing ginger and just kind of
Yeah, and you really want to rub some stuff. Look, you can rub the Arnicare on you.
This is all to eat, but
Well,
the Arnicare is just...
And that's you can finally rub something for that quick relief. So that you'll get. And last but not least, especially since you're talking about weather and everything is so nice here, runner's heel, also called plantar fasciitis.
Yes.
A big issue
it's
here.
awful. It's awful.
And if you've ever had
I've had
you
it.
know
It was terrible.
debilitating. I'm a former runner as well. And so when you do that, let's make sure that you're looking at some of the gel inserts. You can also get obviously ice at the time, but we don't need a prescription, everyone. And that's the whole reason why I think it's important for us to say, you know, what can we look for that's closer to the earth than a prescription that we have to really worry about.
Yeah,
That's
I
really cool.
Really like
A
that.
doctor saying it, natural. You don't always have to go
like
and
the
get that
style, yes.
prescription.
You know, and it's
Okay.
important. And there's always a role for other medications as well, but that's the importance of the patient-doctor bond. And the whole reason why I really wanted to make sure that I got that book out to everyone, to make sure that we can have some souls that are healed from within.
All right, Dr. Ken Redcross, thanks a lot.
Thank
Thank you
you.
for having me,
coming back.
guys.
I appreciate it.
Thanks for having me.
And you know what? You can keep up to date on more health tips from Dr. Ken Redcross at facebook.com/Ken RedcrossMD, and follow him on Twitter and Instagram at Dr. Redcross. We just love him.
Oh,
When
I
are you
love
coming
being
next?
here.
We want to know when you're coming next.
Guys, I'm looking for a home now, so.
We'll buy it here in Denver. Still ahead on Colorado's Best. Firefighters trained to rescue team up with puppies who need to